Our group is Emergency Medicine in the Wilderness and Community.
After an extensive search for yesterday's missing hikers, 3 of the 4 hikers were found alive. Casualties were minimized thanks to life-saving procedures conducted by the hikers themselves.
I am so excited for this hiking trip.
Yes, me too. This is going to be so much fun.
I'm going to take a selfie so we can have this memory forever.
Yay, let's get started. Ouch, it hurts.
Oh no, he fell.
I think he is hurt.
I think he broke his ankle from the fall.
I am so excited for this hiking trip.
So before you do anything, you're going to want to remember BAS. B stands for Body Substance Precautions, gloves, eye protective gear if possible, just to protect yourself against bacteria and viruses. A is for activate resources early, just after your initial assessment, and you're going to want to get your equipment together swiftly. S is to survey the situation before entering it. You don't want to create more casualties. And the other S is just to stay calm. Take a few deep breaths, because you're not as effective when you're anxious.
So Jeremiah just broke his bone, his ankle, and we're gonna figure out what to do. So BAS is the first thing you want to do, but afterwards, the general rule for broken bones is immobilization should be your concentration. So you want to stop the bone from jostling around to cause further injury. You want to remove the clothing. It's better to have a better idea of what the injury looks like and to see if there's any bleeding. Afterwards, you're going to want to pad the injured joint before doing anything else. That way you prevent further injury. You're going to want to create a splint. You can create a splint using anything, straight and rigid. So sticks, hiking poles, I guess even clothing. The point is to just make sure that the bone doesn't move too much. And then you're going to want to tighten the splint with, you can use ropes, belts, or shoelaces if you don't have anything else, but you have to make sure it's not too tight, or else you could prevent circulation. So Jeremiah's injury in particular, this is how you would treat it. You would make sure to include the joint above and below the injury in the splint. And you're going to want to remove the shoe. And you're going to want to pad it using blanket or clothing. In the picture, they have a little towel. That works too. And then they wrap it up. So you're going to want to wrap it up, but again, not too tight. Don't want to prevent any circulation.
We have to go find help.
Jeff, we have to leave you in order to find some.
We will be back for you, Jeff, as soon as we do that. Oh no, there is a bird. You hit Rebecca. I am sorry, Rebecca. I was trying to hit the bird. And now Rebecca is bleeding a lot.
We have to go.
Okay, so somebody's bleeding. The first thing you want to do is lay your victim down. It's a lot easier for heart to pump blood to your head when you're laying down. Oftentimes the skin will tell you how much blood or how much blood is being lost. So if they look paler than normal, cool or moist, that's not a good sign. So you want to control the bleeding by applying direct pressure for 15 minutes. You can use a t-shirt or gauze to do so. If it's a small wound, you can just apply 2 fingers above the gauze directly over the source of bleeding. And if the wound is larger, you can use your open palm. So what not to do, you don't want material that's too bulky. Don't use too much gauze or a t-shirt that's been folded up too many times and to apply pressure, because all that's going to do is dilute the pressure necessary to stop the bleeding. So I included a photo here of what is too much gauze. And you don't want to take your fingers off of the wound too early. It just disrupts the cycle and allows bleeding to further occur. So if the bleeding didn't stop after 15 minutes and the bleeding is still excessive, there are improvisational techniques that we can do. Make a tourniquet, and then there's rapid wound closure. This includes duct tape, staples, and even a needle and thread to sew the skin back together. Your tourniquet should be really tight. You can use belts or even strips of cloth, like from a pant leg or a t-shirt arm. And I included a photo of where to apply it and how to apply it. So it should be about 2 inches above the wound. And they should only be applied to limbs, so arm or leg, never like neck, torso. And you shouldn't apply a tourniquet to a joint. It should just be directly above the joint. And if you have been impaled or someone's been impaled, you want to leave the object in, because if you remove it, it could start gushing blood, and this leads to blood loss. So what you want to do is just use duct tape to secure the object in place so it doesn't move around and cause more damage.
I'm sorry, Rebecca, but right now we have to continue walking to find help for Jeff. It is okay, Sarah.
Yes, let's keep walking while it is still daylight. Guys, I need to take a break from walking.
What is wrong, Jacob?
I can't breathe and I have a pain in my chest.
Do you need water? I think Jacob is having a heart attack.
Oh no, a heart attack. What exactly is it? A blockage of flow to the heart muscle. A silent sign of the heart attack: chest pain, discomfort in the body, difficulty in breathing and dizziness, nausea, and cold sweats. Some common causes could be high blood pressure, obesity, high cholesterol, high blood sugar. What you really want to do is start CPR. For a conscious and unconscious person, you want to put them in a comfortable position, loosen any tight clothing. Unconscious, perform CPR immediately.
We've been walking for so long it turned into nighttime now.
Yes, and it is starting to get cold now too.
Let's start a fire.
Okay, sounds good. I am still so cold.
Yes, me too. We need a bigger fire. Okay, I will add this stick to the fire. Oh no, she fell in the fire. We've been walking for so long.
So Sarah just fell in the fire. How should we help her? First thing to do is identify the type of burn. There are 3 types of burn. We have 1st degree, 2nd degree, and 3rd degree burns. Start by coating the burn by using clean tap water. Make sure the water is not freezing cold, because freezing cold water can lead to further damage. The water should be room temperature. Pour the water over the burn for about 20 minutes. If it is a 3rd degree burn, do not use water because it can lead to infections. Remove any tight items and do this process quickly and carefully. Once the burn is cool, apply a lotion. Try to apply a lotion that contains aloe vera, because aloe vera helps prevent drying. Wrap the area loosely with gauze bandage. If you do not have gauze, even if you do not have access to gauze, you can use banana leaves for the dressing. Try to take a pain reliever medicine if you have access to it. If you do not have access to medicines such as Tylenol or ibuprofen, many plants have known benefits for relieving pain, such as wild lettuce, lavender, and euphorbia racinifera. Remember to bring extra gauze, lotion, gloves, guides for maps, flashlights, duct tape, and let people know where you are at all times.